This conference will now be recorded.
Okay, so welcome again to the COVID-19 and Lupus Community web meeting with Dr. Meenakshi Jolly. I want to read the disclaimer. This event is for educational and informational purposes only and serves to benefit our mission. The Lupus Society of Illinois does not provide medical advice or recommendations. This information should not substitute or replace expert medical care. Before making changes to your medical care, consult your qualified healthcare professionals familiar with your medical condition and health status. The event is being recorded and will be archived on the Lupus Society of Illinois website. All right, now I am going to introduce Dr. Jolly. I'm glad so many people are calling in, or logging in, which is really wonderful. Dr. Jolly, who I'm bringing in now. Okay. Dr. Jolly, are you there?
Yeah.
There's, hi. So this is Dr. Jolly. I'm gonna, click off in a second, but Dr. Jolly is the director of the Rush Lupus Clinic. She's been involved with the Lupus Society of Illinois for many years. She's a huge advocate for lupus patients everywhere. Her patients love her, and we are very grateful for her time and attention today. So without any further ado, I hand it over to Dr. Jolly.
Thank you so much. Like Mary, I'm not a technical genius either. I am going to share some of the slides. I hope all of you are staying safe and doing well, enjoying some time at home. I certainly am enjoying my time at home because this is another opportunity for me to connect with my kids. I was always busy running to work when they were growing up, and now I get some time to interact with them and spend some quality time with them. So I try to look for the silver lining in the situation. I hope you can all find something similar to appreciate in these circumstances. So I just wanted to check with you, Mary, that you can still see the slides and hear me.
Yes.
Okay. So I thought I will go over a couple of things, and you must be all very tired of listening about COVID all the time. But I thought I will go over some very basic things briefly, and then we'll open up to the questions. So when you are exposed to somebody who has COVID, and it may be somebody who may not even have symptoms of COVID, they may just be carrying it within themselves and not have symptoms. One can get coronavirus from them within 1 to 14 days of being exposed to them. Usually this time is about 5 to 6 days, but it can extend to 14 days. Now there is a little bit of findings that people are saying maybe it is longer than 14 days, but this is what is the most well-known time period for developing the disease. It's mainly transmitted through large droplets, and that is why all the emphasis on wearing face masks. Interesting thing. So when I told my daughter about I'm making face mask, they thought I was making some facial cosmetic thing to put on the face rather than face masks. I thought that was very funny. But face masks are back in fashion now. One should always wear them if you're stepping out of the house to go, say, grocery shopping or such. Do wear some face mask. It doesn't have to be, you don't have to struggle for medical variety. People are creating these at home. There are several videos to show how these can be made effectively for people who know sewing and not sewing. I've myself been learning. So do use them. And once you go out and come back to your home, drop them into the washing machine and do the laundry. So don't keep it in the house without having washed, for days. It has been also found that this virus is also excreted in the stool. So hygiene around in the bathroom areas is important to maintain if you're concerned about this. Most often people have dry cough. Fever. Fever is nearly seen in 98%, nearly 100% of patients, but there are some that may not have it. There is dry cough, which are the two top symptoms, and then there can be muscle aches and tiredness. There can be some people who may develop some gastrointestinal symptoms like nausea, vomiting, diarrhea sort of symptoms. This is something new information that has come out, as well as loss of smell is one of the unique features that one may experience as one of the first symptoms of developing COVID. There are other symptoms of headache, sore throat, and such that may develop. But remember, one of the most common symptom is fever in about 98% of patients. In most cases, 80% and above, the symptoms are very mild and people resolve and do very well. So general suggestion around things is one has to be educated, know what to look out for, and plan things. So this is a time when planning in what do I need for home? How many trips should I make? If you're a person who likes to go to do grocery shopping every 1 day, every 2 days or so, this is not the time to do that. Probably, try to plan your day so that you're making less number of trips outside. If there are things that can be delivered at home, your medications or such, some of the pharmacies do that. Maybe that will save you a trip going out. So planning your day-to-day things, how many number of times I have to step out of the house is very important. Even when these restrictions are lifted, I would say do follow some of this care and planning in your day-to-day lives for the next 1, 2, 3 months or so, at least till we have a lot more information on how things are going. Hand washing is the biggest thing. Believe it or not, I couldn't find a disinfectant or disinfectant wipes in the stores. So just routine hand washing for a good 20 seconds nicely. There are a lot of videos on YouTube and such to show you how to do good hand washing. That is the prime thing. Especially coming into the house from outside, wash your hands first thing. If you do have a disinfectant, carry it with you, especially if you're going to, say, a store, carrying a grocery cart or such, things that are touched quite a lot. Sanitize yourself after that. Biggest thing is of physical distance, maintaining the physical distance. Note that I did not say social distancing. You can still have relationships and interact with people, computers, phones, FaceTime, or whatever mode you want to use, do that. People are also having some social interactions across the street with other people. As far as there is distance, physical distance, social interactions can happen. If you are a jogger, the distance you need to maintain is larger and longer. So try to avoid as much as you can going out. If you can prevent that, that would be good. Look out for others and seek help if needed. So give and take. If you need help, take it. Ask people, this is the help I need. For example, in our block, if there's somebody who needs a grocery for the elderly couple, we can drop that grocery there. So that is an easier thing to done. And why take the risk of going out if you are at high risk for catching infections? Similarly, look out for others. Continue to take your medications. Don't freak out about, should I take these medicines because they suppress my immune system? Make sure you have them at home. You don't run out of your supplies. If you're doing well, relatively well with your condition, and you need to have your doctor visit, telephone visits, virtual visits, video visits are being offered. Doctors are more responsive also to my chart messages this time around, realizing that these are unusual situations, and people are trying their best to help out as much as they can. Now, I know a lot of our patients are on medicines that require a lot of lab testing, blood testing, and such. So in case it is required, talk to your doctor first. Is it something that can wait a little bit to get over, that you don't have to go out to get it done? If they suggest that you have to do it, then can you do it somewhere close by? Take precautions, cleanliness, hand washing. Maybe going there in early hours when there are less number of people there, less crowded, may be helpful. Those are things to consider. Even in our house, when we go to me and my husband are both doctors, when we go out to the hospital, we keep our inside outdoor clothes. As soon as we come inside, we undress, take a shower, and put the clothes right away into washing. Common things, whenever you go out in common areas, stores, groceries, and all that, be careful about the doorknobs and things like that you're touching. If you can just use your elbow or your foot, do that if that is possible. But again, hand washing is very important after that. So these are a document of clinical guidelines or guidance for the doctors. And this is not for patients, but for doctors. And I thought I will share some of this with you. This was just released on the 11th from our American College of Rheumatology. And this is for, some guidelines for how to treat adult patients during this time of COVID pandemic. It is not to replace clinical judgment of doctors, and this does not apply to all situations. Talking to your doctor would make more sense, and making individualized treatment plans would make more sense, but this is general guidelines for doctors. So there were 10 rheumatologists and 4 infectious disease doctors that went through this process of developing the guidelines, and then voting was taken. And I will run through some of these. These are general statements for patients with rheumatic diseases. Now, patients who don't do very well, that means poor outcome, their risk factors are if they're elderly or they have other medical problems. So those are the people that are at higher risk, generally speaking. So keep that in mind. The preventative measures, again, hand hygiene, physical distancing is important. And in order to decrease the exposure risk to the virus for the patients, maybe it is appropriate to cut down the number of times you have to go see the doctors or go to the healthcare facility if this is reasonable and possible with your condition. And that means that can your lab tests be done less frequently than it was being done earlier? How long can we extend that duration? Can we do our visits over the telephone? If you're on some IV medications, is this a medication that you can take maybe a month or 2 later? So those are good questions to talk to your to your rheumatologist to discuss that. And this is to possibly decrease your exposure of risk. If we have patients on steroids, we always try to put them on the lowest possible dose. This is nothing new in terms of pandemic with coronavirus. And similarly, we are told not to stop the steroids abruptly. This is again something that is very routine for all our patients that we treat, irrespective of coronavirus. There is some murmuring going on about one of the blood pressure medicine called ACE inhibitor or ARBs, examples being lisinopril and all that can it increase the risk of you catching coronavirus? Currently, there is nothing concrete saying that it increases your risk. So the suggestion is to continue taking that if you are on this medicine, lisinopril, Zestril, kind of losartan kind of medications. So this is for patients with rheumatic diseases who are doing well and do not have COVID or exposure to COVID. The recommendation is to continue all medications, including NSAIDs. NSAIDs are medicines like ibuprofen, naproxen, and such. And why NSAIDs are again being discussed is because there was some suggestion that maybe being on these medicines increases the risk of catching coronavirus. And so far, we don't have any concrete data on that. So you should continue, if you're doing well on that, continue to do that. Now, there is one class of drug called IL-6 inhibitor, which is sarilumab or Kevzara medication. It's not really for our lupus patients, but some rheumatoid arthritis patients may be on that, and that may also be continued, but this needs to be discussed on an individual basis. If somebody has a history of any major organ of the body being severely under inflammation from lupus or such, the dose of the medicines that you're taking for your lupus, meaning your immunosuppression medicine, should not be decreased. Okay. Another thing that came is that patients frequently with lupus or autoimmune diseases have osteoporosis and may be on this medicine called denosumab or Prolia. So we know that stopping that medicine or not getting it on time can really make your bones more weak very quickly and increase the risk of fracture. So the suggestion that came out is that the time period in between two injections of Prolia or denosumab should not go beyond every 8 months if possible. A general thing for our patients, lupus patients, hydroxychloroquine, your Plaquenil should be continued. If patients need to be started on belimumab, that can be started. There's no problem with that. Now, these are patients who have new disease or very active rheumatic disease, but no history of COVID or being exposed to that. If they have really bad joint disease and it is doing very well on hydroxychloroquine, suggestion is to continue chloroquine. If for some reason it is not available, your doctor can switch you to another medication. There are several different options available, methotrexate, azathioprine, and such. Those are available. If for some reason one of your rheumatic diseases, you have active inflammation in the joints and you were on this IL-6 inhibitor drug, the suggestion is to continue it. If it is not available, then your doctor would consider switching you. Now, if you have very highly active disease in your joints, then it is also okay to start patients on biologics like Enbrel and Humira. I'm not talking here about lupus patients because those medicines are not usually used in lupus patients, but more for the inflammatory arthritis like rheumatoid arthritis. Now, if need be for the joints, low doses of steroids, where I'm talking about, for example, prednisone of any dose less than 10 milligrams per day or 10 milligrams per day, or even ibuprofen sort of medications can be used. Now, if you have inflammation in other organs of your body or vital organs are involved and you have active disease, for example, it's affecting your kidneys from lupus, then high doses of steroids and any of these immunosuppressant medications can be started provided you have no diagnosis of COVID or not exposed to that. Now, for patients who are undergoing treatment, they're stable and have had exposure to COVID, but no symptoms of COVID. In those, the suggestions are to continue medicines like hydroxychloroquine, NSAIDs like ibuprofen-like medications, or if you are on sulfasalazine, say for your arthritis, that can be continued. But the suggestion is if you've been exposed to the virus and yet do not have symptoms, so to stop the other medicines that suppress your immune system until you're waiting to get the result of your COVID test being negative, or at least 2 weeks of symptom-free period. So this is important that if you've had exposure, temporarily stop your immunosuppressive medicines, but not hydroxychloroquine or ibuprofen and all that till you get the results of your COVID test being negative, or if you've not had any symptoms for 2 weeks after the exposure. And again, regarding people who are on IL-6 inhibitor, which is not a lot of our lupus patients at all, then you may need to discuss that with your primary care doctor. Now, if you have a rheumatic disease and you have COVID or you're presumed to have this infection, hydroxychloroquine still can be continued. In fact, should be continued. All the other medications, most of them are held or stopped. If you develop severe lung symptoms, in those cases, ibuprofen-like medications should be stopped. There are some studies going on with this IL-6 inhibitor to see if it helps patients with COVID disease, severe disease, and in some circumstances, if a patient is on this, it may be continued. Again, not a medication that is relevant to our lupus patients. Now, I wanted to briefly share with you some of the results. There is a global, worldwide registry that is developed for COVID-19 among rheumatology patients. So this is a registry, 2 types of registry. One is where a patient can go in and enter their information. And there are 6,000 patients who have done that from 85 different countries. And there's another registry where the doctors can report their patients if they have developed COVID, patients with rheumatological disease. And I want to share briefly with you some of the results from this repository, from the doctor part of the repository. So they already have about 300 patients in this, but the last data I have is from 234 patients with a positive COVID. Okay, of those, 37% had rheumatoid arthritis, 19% had lupus, and you can see all the other autoimmune diseases that had that. More rheumatoid arthritis patients are listed here because rheumatoid arthritis is more common than lupus patients, but lupus patients can get it. 76% of these patients were women. If you look at the data from China, in that more than 50% of patients were men. Now we know our autoimmune diseases are more common among women, so that may be the reason why women are more seen in this registry. Now, 20% of these patients were older than 65 years. There are patients who are younger, in their 40s and such, would get it. So it is not that only people who are over 65 will get COVID. Younger people also can get COVID. Now, this is a worldwide registry. So in this registry, more than half of the patients are white, about 19% are Black. And if I talk to you about the risk factors, we're having other medical problems, and you can see about more than 1/3 of the patients had high blood pressure problems. 20% of the patients had some history of lung disease. 9% of the patients had some heart or circulation type of disease, and 11% of patients had diabetes. And people can have more than one, like patients can have hypertension and diabetes and such. So those are the patients that may be at risk. Commonly, I'm asked about what are the medications. Does prednisone increase my risk? Does Plaquenil decrease my risk? What about these other medications I'm taking? So this is a good table for that. And it tells you that out of these 234 patients, 68% were on what we call, as doctors call, conventional synthetic immunosuppressive medicines. Example is like methotrexate. Now, note here that nearly 30% of these patients were taking hydroxychloroquine and developed COVID. So there is the answer, indirect answer, that it does not seem to have a protective role in patients who are already on hydroxychloroquine. But these are smaller numbers. These were 68 patients. Even currently, the data is very controversial whether using hydroxychloroquine will prevent or treat COVID. Now, 37% patients were on different biologics. These could be Enbrels, Humira, rituximab, and such. If you see, 32% of patients were taking some corticosteroid. I do not have the data on what dose of steroids they were taking. So if you on the guidelines, it says that you should be on the lowest possible dose that is feasible with your condition. Of our patients, 39% of the patients required hospitalization. Of course, our patients are on different medications, frequently have high blood pressure disease, a high blood pressure problem, or other diseases. The death rate was 4%. 10 patients out of 234 died. If you look at the flu death rate, those are 0.1%. In China, the death rate, yeah.
I'm so sorry to interrupt, but there was a question when you were talking about methotrexate. The same question was about Cellcept.
And that
Is
would
that
also
the same
fall in this
conventional?
category of conventional synthetic. Methotrexate, sulfasalazine, azathioprine, Cellcept, or mycophenolate, they all fall in that conventional synthetic immunosuppressive medicines, and that's why nearly 70% of patients are on that.
Okay.
So going back to the death rate, 4%, this is significantly higher than what flu season does. Okay, so because that is a question that keeps coming up. However, 4% is also the same rate that we are seeing for death among non-rheumatological patients in the general population about related to COVID. So early signals in this are not showing that our rheumatology patients are at a higher risk for death. But again, these are smaller samples, smaller number of patients. The death rate in the general US population currently, what is being discussed, is about 4%. In China, 8 to 12% was reported in some of the studies. I want to show you this because several questions come around shortages of the medication. And this is the FDA website on FDA drug shortages. And you can see that hydroxychloroquine is currently in shortage because FDA did approve, after a lot of media activity, the hospitals to stockpile the medication and for use in emergency situation. It did not approve it for use to treat COVID or to prevent COVID. It is for stockpiling of the medication or use in emergency situation. So do not get confused by FDA having approved hydroxychloroquine use for treatment of COVID. So I hear a lot that there are some concerns around refills for hydroxychloroquine. My suggestions are being proactive. Check if you do have refills from your doctor, are they on file? Before you run out of your medication, call your doctor, see you have it, call your pharmacy, see if you can get the 3-month refill instead of 1 month. That will prevent you from making multiple trips. And in some cases, insurance and pharmacies allowing patients to fill the 3-month fill. Pharmacies are also in a lot of cases allowing you to refill before you run out. So don't wait till the last tablet to collect your refill. Maybe start that 2 weeks ahead. If you're having issues, call other pharmacies, talk to the pharmacist, talk to them if they can talk to other pharmacies and get it, procure it for you because you've been on it. Check for if it can be ordered through mail order pharmacy. If you're having trouble, it is delivered at home and frequently it can be 3 months supply and they may have access to different other sources. Again, check with support groups, local organizations, different organizations, along with Lupus Society of Illinois, the government, American College of Rheumatology. People have been signing petitions, sending all this, and several actions have resulted from that. There are changes in telling the drug companies to ramp up the production of hydroxychloroquine, so there should not be shortages. Also, hydroxychloroquine is being imported from other countries like India, where it is created for malaria use, and it is one of the largest manufacturer of this medication, and it is being imported from there to overcome these shortages. I wanted to tell you in the end that this is the graph. This was the projection that of COVID, how it was increasing, but all this physical distancing and the measures we are doing, the curve has started to flatten. It has not gone anywhere, but there are cases still happening, but less than what was happening before. So there is hope, but I don't think it is completely something that is gone by May 1st. Nobody can give you dates on that or an expectation of that, but follow general preventative and cautious measures. And that is the whole intent of sharing all this information with you so that you continue to stay safe.
Yeah. Okay. Wonderful. Then, are you going to turn your camera on?
Yeah, I'm just turning it on.
Okay. Do you want me to turn my camera on?
Yes.
Okay. We did get one question, and I'm not 100% sure I understand it, but it's, is HCQ still effective past 6 months, 12 months, like shelf life? It looks like they're asking. Actually, yeah, shelf life.
Shelf life, yeah. So generally speaking, it should be active. The compound should still be active, but these are FDA regulations that you have to look at when you can use it or not. But if you didn't have anything, then I would suggest do go ahead and take that rather than not take anything. The chemical compound should be okay. I'm not the best person to answer this question. It should still be okay, but the FDA regulations do go by dates.
Okay. And then actually, I can't see you. I'm not sure if it might be a Wi-Fi issue, but hopefully everyone else can. There's another question. Is it a surprise to you that the media mentions diabetes, asthma, hypertension when they talk about pre-existing conditions for vulnerable population, but not mention lupus or other rheumatic inflammatory diseases?
So I can't make this camera to work somehow. It's just pooling. So yes, lupus itself is not what the problem is here. Remember, our immune system is overactive than underactive. It is the medications that you're taking that may increase your risk because you're immunosuppressed. And then lupus can cause other things like, if it has affected your kidneys, do you have high blood pressure problem from that? If you're on steroids, has that also been associated with diabetes in your case? People first look at the most common diseases before looking at things that are not as common. So the data we have available comes mainly from China, and this is, the state of information in this disease is growing every day, but it will take some time before people start focusing their attention on conditions that are not as common. But the increased risk is mainly related to increased other organ involvement, other medical conditions that our patients might be having, or taking the medications that suppress their immune system. So I'm not surprised that it is not in those lists, because you have to start to learn the alphabets ABC before you start moving to putting 3-4 words together. So we are not at that state yet. But these efforts, like the global registry that is happening for rheumatology, we are all trying to understand it. So there are efforts going on that from the rheumatology side also to better understand these things.
Okay. So here's another one. Are you saying in general lupus patients should extend precaution past the general population due to our compromised immune status?
So this is not an official suggestion, but I would say do talk to your doctor about it. Everyone's case is different. So if depending on what medications you are taking, which medications you're taking, what doses you are on, what are your other medical conditions, that is what will decide. But it never hurts to take precautions. You know what the precautions are. It is in your best interest. Even if the social distancing and all that improves, use caution more. That may open for the, healthy, non-diseased patients, non-diseased people. But for us, we need to take caution on that.
Okay. Can getting COVID-19 trigger a lupus flare? That's a really interesting question.
It definitely can. Not that we know it from any particular data, but think of it as any infection can trigger any lupus related flare. We know that when patients get any infections, flus or bacterial infections, all those things can trigger flares. Any stresses can increase the flares. So these are stressful situations. Say somebody gets viral illness. I don't think it is specific to COVID itself, but any kind of infection can trigger a flare.
Okay, and then the reverse also. If you're in a lupus flare, does it predispose you or does it make you more vulnerable to getting COVID?
Again, if you are in a flare, it is very much possible that you are on medicines that also suppress your immune system. And that may increase your risk of catching the infection. There is also, the details of at a smaller level, how the immune system functions in your body. There may also be effects on that when you are in a flare, and that possibly could increase your risk to catch COVID too, but I don't have any concrete data to tell you that.
Yeah, and that's the problem with this in general, isn't it? That there really is not much concrete data about this. It just they just don't have it, right?
Yes, we don't have that. And so, like any other day, you want to prevent any infections, catching any infections, because catching any infection will trigger your disease. Any stresses will trigger your disease. So taking precaution is the wise thing to do. Maybe we need to take a little more precaution than people who don't have lupus because of the nature of the condition and the medications and what other diseases we develop while we are on this.
Right. We do have a couple other questions, but I did want to say something about the HCQ Plaquenil. We have a petition we want to present to the governor to try and create constraints so that people who don't legitimately need it are hoarding it so that lupus patients don't get it, because obviously we're in a very stressful time right now. And as you mentioned, stress makes everything worse, certainly for lupus. So everybody's stressed out. Lupus patients are a vulnerable population, so they're a little more stressed out. And then if you switch up somebody's medication, that's really, not only would that add stress, but that does throw off their system, right? Like that would be a problem to
Yes.
suddenly switch, right?
Stress can affect the immune system's functioning, and that is how stress can trigger flares. Because the immune functioning gets affected. Different chemicals are released in the body in a different way, and that can trigger a lupus flare. And so, yes, and that was one of the things that we also mentioned, that, you know, there is so much of stress and unpredictability of flares and medicines, and now we are also dealing with shortages of medications adding to the stress.
Right. Okay. The next question, with lupus pneumonitis, are you more susceptible to COVID-19 since it affects the respiratory system so harshly?
So people who have underlying lung conditions, which is one of them is lupus pneumonitis, does put you at a high risk. And if you get it, you are more at risk of not doing so well. If you have any underlying lung condition, lupus pneumonitis is one of those.
Okay. Yeah, I think I saw that if your lungs were compromised in any way, that COVID could make everything just that much worse. It could really attack the lungs, right? I mean, it's a respiratory virus primarily, right?
Yes, exactly. And so the stresses on the lung and the inflammation, level of inflammation in the lungs could be that much that your lungs may not be able to handle if they're already compromised with something else happening there. So that is a very good question, but patients, especially with lupus, who have any underlying lung disease, not particularly limited to lupus-related lung disease, you're at a higher risk and would be very cautious. I, again, make the notion of using masks, hand washing, again, for all patients, and especially those on with underlying other organ involvements.
Okay. Here's another question. Do you know what antibody they measure to see if you have or have had COVID?
So I know now there are new tests to check for antibodies. I have not read greatly in detail about it. It's not widely available. There are two types of antibodies they check for against this virus specifically. I am presuming those are IgM and IgG antibody. IgM is usually for any viral infection when we do to tell you if you have it or have you cleared it. So IgM goes up if you are in the process of having an infection. With time, IgG antibody goes up and IgM clears out, and that tells you that you've recovered from that. But this test is not yet widely available. So yes, I hear that it is coming out, or it is, it has been released, but I don't know of how widely it is available. I checked on our hospital website trying to see how to order it, and I wasn't able to find that on our website.
Okay.
I had some cough and chest pain symptoms 2-3 weeks ago suddenly, and I had myself tested for COVID, which was negative. But the processes set up are very good and very efficient. I know it firsthand because I had myself tested in the general queue. And so I was myself interested in checking if these antibody tests were available, but I don't think they're widely available currently.
Yeah. Well, I do know that, well, the antibody test, I don't know that we have it in Illinois. I heard Colorado was working on it, but I think all the testing is really pretty delayed.
Yes.
There's a question about wearing gloves and face coverings. I think you might have mentioned that early on. how important that is?
Face covering definitely, and then use the disinfectant or hand washing. I don't think you gain anything if you don't wear gloves properly. These days, I see gloves discarded all over in the parking lots, on the street, everywhere. I think it is adding, even, it's not which garbage can it should go to, where you should drop it. There are multiple layers of things. What I suggest is good hand washing and good disinfectant. Disinfectant with over 50% of alcohol. I will tell you, I wasn't able to find disinfectants for myself and my household, but I was able to find some rubbing alcohol, and I just diluted that with water. If I need to, I just have it at the door to disinfect my hands with that if I am not close to being able to wash it. So I don't think gloves, you may get that false sense of security wearing gloves that everything is safe, but you may be just carrying it from one place to the other as you would with your hands. Hand washing and disinfecting hands is the most important thing you can do.
Yeah. And somebody told me that the purpose of the face mask, not just to protect what you're breathing in, but it's sort of, you don't touch your face as often. You can't touch your face as often because you have a mask on, right? So,
you would be surprised, and I find this, I knew this beforehand, that people who wear glasses and wear face mask, your glasses keep fogging every 2 seconds, so you may end up touching it all the time, readjusting it. So yes, take that into account. But the fitting of the face mask has to be good. So try to do a multiple layer face mask if you can, not just one layer.
Okay. Okay. Another question, are there any routine lab orders that should usually get checked with patients with lupus that could indicate that you might have COVID?
No, there are no routine lab orders. Even right now, as I speak, it is if you get symptoms, if you have been exposed or and you develop symptoms is when the test is ordered. Based on what your underlying risk factors are also taken into account to see how quickly you should be checked or not. In sometimes, if you've just been exposed, recommendation could be just quarantine yourself, watch yourself, check your temperatures, nothing developed, 2 weeks done, you're okay. But the algorithm that is used is to based on what your symptoms are and what your underlying medical problems and travel history and all that is.
Okay. Another question, any additional advice to medical professionals, first responders, we actually have had several nurses and healthcare professionals reach out to us with questions specifically. They have lupus, they're in a high risk category, but still they are going to work to and being exposed.
That's a very tough situation. As a healthcare provider myself, we have to do our bit to help, but I really don't know what would be a good answer for this. I will give you a simile of when you're in a plane and the recommendations they give you is put your mask first before putting the mask on your family member sitting next to you or your child. So if you're not well, you cannot help others longer. So take your precautions. If depending on what your lupus is, which organs it manifests, what medications you're taking, what other medical problems you have, judge your risk. Maybe it is worthwhile for you to monitor and help people through a distance in a different way rather than being in situations where the risk of your exposure is high. So that is also worthwhile help. And for healthcare providers, I know that that if they have been exposed to others, even without symptoms, they can get tested for COVID. So their testing strategy is different so that we can have as many healthcare providers available to patients to provide care.
Okay. Another question, if you were to run out of Plaquenil, how many days, weeks does it take for your body to register that you are being denied it? I'm guessing the effects of that to leave your body, and what would show that? What tests?
Um, there are no tests. I mean, short of doing a blood level of how much Plaquenil you or hydroxychloroquine you have in your system, there is no test that will show you otherwise how much Plaquenil is left in your body. But again, that involves taking the risk of going to do the blood test, and that may or may not even be covered under your insurance. Usually, Plaquenil, if you remember when it is started, we say that it will take anywhere from 2 to 6 weeks to even kick in. So the guess is that it will stay in your body about 2 to 4 weeks or so before you start feeling the effects. And the effects would be, if you see anything, would be, your symptoms of lupus trying to come back. You may develop a flare, could be a rash, could be joints, could be tiredness, or any of those kinds of things.
Okay. And then we got a question emailed in. I heard Dr. Jolly mention indications for patients using losartan, but did not hear the recommendation. I use losartan 100 milligrams a day to treat high blood pressure. Could you speak a little bit about that and any concerns the medication has related to COVID?
Right. So losartan I mentioned along with the other blood pressure medicines. So these category of medicines are called ACE inhibitors or angiotensin receptor blockers. Losartan, Zestril, lisinopril, they are Prinavil, they are examples of these medications. There was some concern that maybe people who were taking these medicines or even NSAIDs like ibuprofen are at a higher risk to develop COVID. Catch the infection. But this concern was raised based on some data from China, but currently there is no data that supports that. The American College of Rheumatology suggests that you should continue taking this medication as you were taking if you were taking it before.
Okay. I got a question. Should my caretaker wear a mask when she comes around me? I'm assuming that it's a lupus patient. I'm assuming if they do have COVID, absolutely, right?
Yes, absolutely. But I'm guessing caretaker, meaning at home. And I would say that if these are people like your home, family members, probably not. But depending again on what medications you're on, I do think that your caretaker, if this is somebody coming from outside, should wear a mask because there are people who can carry the COVID virus and not have symptoms.
Sure.
So even for us, when I go to the hospital, my temperature is checked before I'm allowed entry into the hospital building. So if that is the rule for even all healthcare providers to enter a hospital, it should be something that you should be careful about and check about, are you having any symptoms, any fever? If anything is happening, maybe tell them to stay at home or find another alternative if you are able to find another alternative for a person to take care of you.
Okay. Your temperature being taken, is that because of COVID or is that a regular
Yes.
thing? COVID, yeah.
Yes, before COVID times, one could walk into the office space, hospitals, and even in the clinics now, if at every floor there are people taking temperatures of people walking in. So, sometimes people may not know they're running a low-grade fever or such. So there can be people who may carry the virus within them without developing a symptom. And so you have to be careful, not just of the people who have COVID, but also of anyone and everyone around.
Okay. And then here's a question. How would they tell the difference if my numbers are always high? I have lupus and Sojourns. I'm guessing that that's dovetailing off of the earlier question about the Plaquenil and testing in the blood.
I don't know what numbers that this question refers to. So I don't know exactly what numbers they're referring to in this.
Okay, maybe they can send another chat, and we'll get to that. Do you suggest all lupus patients get tested for COVID-19?
No, only if you have any symptoms or have been exposed to somebody and develop any significant symptoms, or dependent on what medications and otherwise you have. If you're developing any symptoms, and have concerns, then call the number and get yourself tested. They will tell you when you call for triage to the hospital to get the test, they will run through all the information and tell you whether you need it or you don't need it.
Okay, can I ask, would it be recommended if we had more than enough tests, would it make sense for lupus patients to check themselves for COVID more regularly?
So this is not a test that they can do it by themselves.
Right.
This point of stage, even then in that situation, it's a very good question. Even in that situation, I wouldn't be doing it for anyone and everyone.
Okay.
Within lupus patients, there are some people that are doing very well. Yes, they have diagnosis of lupus and very well controlled just on hydroxychloroquine. Those would not be my patients if they did not have any symptoms I would check for. But definitely for patients probably who had more blood pressure, diabetes, lung disease, kidney disease on stronger medications or such, I might think about that.
Okay. Next question, you mentioned people may have COVID-19 but not show any symptoms. Should lupus patients that may possibly have COVID but have no symptoms or show mild symptoms continue all medications as regularly? Should anything be done differently while waiting to be tested, waiting for test results?
So that's one of the things that I had discussed in the slides that I had shown, the American College of Rheumatology recommendations. And I can see if I can pull it up. But if you are while waiting for the tests, you should continue your hydroxychloroquine and other medications. Other medications should be held until you get your results of the COVID or 2 weeks have passed and you have not developed any symptoms.
Okay. Okay, so the question, the individual chatted back and they said referring to IgG, IgM.
Oh, okay. No, so those are different numbers. If these are being checked, and again, as I said, I do not have detailed knowledge of this test itself. Usually, those IgG and IgM numbers are against specific virus, the coronavirus that they would be testing for, not the usual IgG and IgM numbers that we are checking in lupus.
Okay, okay. Some hospitals have little stands with hand sanitizer and masks, but I'm wary of using their mask because so many sick people shove their hands into it and get and to get a mask. Does that make sense? Does that have merit? Pardon me.
The hand sanitizer should be okay, but if you carry your own hand sanitizer and a mask, you can use that. If you prefer to use that, you can do that. But I do use hand sanitizer very frequently. But you have sanitized, even if you're touching the top of the dispenser of the hand sanitizer and you're assuming somebody touched it who may have had COVID, the product that is coming out, you're using it liberally on your hands and that will disinfect your hands. So the hand sanitizer is absolutely okay. The masks, the way they are generally stored in these stands are the outside is on the inner side and you just pull it from the thing that goes around your ears. So it should be okay. It is better than not having anything. But if you have a better option of, face masks yourself, then use that. But remember that the medical level face masks perform much better than the homemade face masks.
There's a lot of YouTube videos on homemade face masks. Some of them are pretty creative. And
Yes.
there's some YouTubes on how to make your own hand sanitizer. You need rubbing alcohol, I think it like 90%, like 1/3 rubbing alcohol, 2/3 aloe vera gel or something. But that's an option as well. Like you were talking about the rubbing alcohol that you used. You
Yeah,
diluted
and
it.
I used the same rubbing alcohol, mixed it with Vaseline lotion and some water to make my own hand sanitizer too.
Yeah, people are getting creative. Are you providing documentation for your patients that are HCW or are HCW to shelter in place as the rest of the state? That are, I don't know exactly what that question is. So maybe somebody can chat. Oh, to be given to their employers. Oh, I see. Maybe a note or.
So, from what I know, what I can understand of the question, we have general templates of letters that we provide to our patients through the MyChart. Most of the hospitals, clinics are on Epic or some other electronic medical record. Within that itself, we can attach the letter for lupus patients that they can provide to their employers, that if they are on high risk and if they should work from home and to decrease their exposure, and if any questions, to contact the provider. So we do have those general specific letters that I've been providing to my patients based on their risks.
Okay, and actually HCW wasn't a typo, it was healthcare workers.
Oh,
So,
okay.
yeah, the questioner is an RN. So she's saying,
Yes, we do have letters that we provide, especially depending on what medications. So if patient, as I was mentioning to you, had lupus very well controlled only on hydroxychloroquine, and I don't think there is very many other added risk factors,
okay,
I wouldn't be that wary of restricting them. But if there was a patient who is on other immunosuppressive medications, has other risk factors, I would very gladly, for my patients, provide that letter, including healthcare workers. I have
okay,
police officers and such in similar situations and have provided such letters to them.
okay, so this individual is on immunosuppressives and steroids, and so that you would write a letter for that.
Yes, they need to contact their rheumatologist and they should be able to provide
Right.
that.
Yeah, you can't write a letter for someone you don't know.
Yeah.
Here's another question. Do VOG face masks really help filter out germs? And what other brands of masks that are reusable would you recommend for us to wear?
So I don't know what VOG
I don't either.
is. So I will tell you that there are medical level face masks, which are very efficient, and then there are homemade masks, and the efficiency of those in filtering out germs is variable depending on what materials have been used in creating it, how many layers, how well the fitting is of that, and how well you wear it. Letting it hanging from one ear or underneath your nose is not going to protect even with the best medical level filter.
Okay.
Um, so there are a lot of things going on in there, but even if it provides 20 to 40% protection, that is better than no protection. So that is why I suggest wearing them.
Okay. A VOG masks are cloth masks that a lot of people with I think cystic fibrosis wear. So that's
Okay.
what.
I
Okay.
don't know of that specific
I'm sorry.
mask. Cloth masks generally about 20 to 40, at the most 50% protection, but not more than that.
Wow. Even if you layer them up.
Yeah, but there hasn't been that much testing of all
Sure.
those levels. There are a lot of fitting issues, a lot of layering, what materials you're using to layer.
Okay.
But again, depending on what the composition is, how the fitting is, one has to take that into action. But again, anything is better than nothing.
Okay. All right. Wonderful. One last question, because the hour is almost up. Is it safe to donate blood with an autoimmune disease?
So for in terms of lupus patients, when they are donating blood or plasma, generally from what I know, that it is discouraged. Also because there are concerns for different kinds of antibodies being present in the blood. So if one was thinking, a good question at this point of time comes that if people have had COVID and they've recovered from it, there are now studies going on in studying if taking a component of the blood from those recovered patients and infusing it to people who are right now struggling with COVID would help them recover from COVID earlier, because your body has created some antibodies to fight COVID already. So for that matter, plasma, that component of blood, is what is supposed to be given. I know the study is started at University of Chicago, but generally speaking, because there are concerns with antibodies in patients with lupus, blood donation and types is discouraged. Also keep in mind, a lot of other factors go into whether you can donate blood, including how good your hemoglobin is, do you have underlying lung condition, heart condition, and such. So one has to take all those concerns into mind while thinking about blood donation.
Okay. All right. Wonderful. Well, this has been very informative. Thank you so much, Dr. Jolly, for all of your time. I think it's really creative how you got out of sharing your video. It's been the Mary Show for about a half.
fooling. I'm seriously telling you. I put on my lipstick for this purpose, but I can't even show you my face.
I know, it's terrible, but we really do appreciate it. The feedback's already very positive. I thank you very much. And if there's any additional questions, please go ahead and send them to my email. And we'll be in touch with a recording of this video shortly, as well as other news about what we're doing to support lupus patients during this time. Thank you so much, everyone, for calling in, for all your questions. Again, Dr. Jolly, I'm sure I'll talk to you again soon. And everybody have a wonderful night and stay safe.